My name is Kim Kruczek, and I dance at the Chicago West Loop studio.
That's awesome. All right, so being an oncologist, you see every case possible, from severe to mild. How does that make you feel as a doctor? Because obviously, as a woman as well, there's a connection there.
Yes. I think that's what drew me to oncology as a field. It's really a remarkable opportunity and a way to connect with people in some of the scariest times of their lives. And I think that no matter how severe a cancer case may be, it's very unique to that individual patient. And so even early stage diagnoses can be life-altering, and everyone is on a really unique journey, and we try to support every patient however they may need.
What's the one advice you give to every woman out there? Because a lot of times people are almost afraid to find out.
Absolutely, that's true. The reason why we do screening mammograms and encourage people to get checked on a regular basis is so that we can find cancers early, because when we find early stage disease, we have a lot of treatment options, and often we're able to cure patients, which is a phenomenal thing to say, but we need patients to get screened on a regular basis.
What are some of the symptoms that goes with that? Because, it's one thing to get diagnosed, but then when you start the treatments, they're taxing in a sense. I remember seeing my sister go through it and sitting through an hour and a half of her getting chemo done.
Yes.
It really does knock the wind out of you.
It does. It can. It certainly can. I think the most common thing we hear from most of our patients is that they feel tired after their treatment. They may not have the same amount of energy that they had. Patients may lose some of their appetite. They don't want to eat as much. We try not to let our patients lose weight, and we really encourage good nutrition. We worry about the risk of infection, and so we're always checking people's blood counts. We check liver function regularly, kidney function all the time. People can have GI issues with some of the treatment, changes in the hair, changes in the skin, and all of those things, may sound like no big deal to someone not going through it, but when it's happening to you and happening to your body, it really is a big deal.
Yeah, of course. I remember seeing my sister lose her hair, and her hair was her life in a sense. It really does psychologically play a big part in it.
Yes.
So how do you help them through that?
I think patients sometimes feel like they lost that old version of themselves, like there is now a new normal, and it's really hard because patients sometimes don't feel like a real woman, so to speak. Their body becomes a little bit not their own, and they go through biopsies and may have a lumpectomy or even a mastectomy, and they don't feel beautiful anymore, and they struggle with that emotionally. And I think as a society we tell women, be strong and be a fighter, but sometimes it's really hard. And sometimes people feel down, and I try to tell my patients that that's okay. It's okay to have good days and bad days, and you don't have to be strong all the time. I say, especially within the walls of my exam room, I want patients to be honest with me, because that's really the only way we can help, is if we know what someone is dealing with, both physically and spiritually and psychologically.
It's funny because I started seeing my sister declining until I took her to the first dance class. And it's like months later, I had asked her, I said, what did dancing do for you? And she said, I felt like a woman again.
Yes.
So in some of the cases, I'm sure you have patients that you probably recommended dancing to.
I do.
What was the response to that?
I talk about dancing a lot with my patients, actually. One, because I love it so much, and I think it's a way to really connect with people. And at the end of the day, we're all people. Whether we're patients or physicians or nurses or caregivers, we're all people, and we all want to feel good. And it's a very easy example that I can share with my patients. When I was feeling overwhelmed with work and overwhelmed with my training, I turned to dance, and I think it made me a happier and more confident person. And so when I see someone struggling, I really encourage people to get out there, to get off the couch, and to move their bodies, because our bodies are made to move, and it makes everybody feel better.
So tell me, what are some of the benefits of actually taking a dance class? Because we both agree that it's going to make you feel better.
Yeah.
However, what are the benefits? What is the medical part of this?
It's interesting. I think it makes sense, and it's kind of common sense, that it's good to be physically active, but I think the world didn't believe us as doctors, and so we have actually had to do scientific studies to prove that there is a benefit in staying physically active. And so there are studies out there looking at breast cancer patients in particular, and the risk of mortality from breast cancer declines with regular physical activity, and not only the risk of mortality from breast cancer, but overall mortality declines with regular physical activity. And so our main societies, for example, the American Cancer Society, does recommend targeting at least 150 minutes of physical activity a week in patients.
Interesting you say that, because yes, and the same thing happened with my sister, and and she goes, going to the gym is just demoralizing.
Agree.
So
I've been there. Yes.
How is dancing, better than that in a sense?
Yeah, so when you think of those 150 minutes, that can be very daunting, but what it breaks down to is about 5 days a week, 30 minutes a day. And so if I were to get on the treadmill for 30 minutes, I would be looking at that timer all 30 minutes. But when I take a 40-minute lesson with Andre, for example, all of a sudden he's telling me, okay, good job, you did great today, it's over. And I was just moving for a full 40 minutes, and I didn't look at the clock once. Not one time. And so it's very easy to get that time in when you're doing something you love.
Also, I mean, when you're in a treadmill, you're working on just certain parts of your body.
It's
when you're
boring.
Dancing, you have music, you have a partner, you're talking, you're enjoying it. There's
you laugh, you feel good.
And that was something that I wanted to ask you. It's going into a dance studio for somebody that's going through treatment, through cancer treatment. What does the studio environment do for them?
It's very uplifting. I think no matter who you are or where you're coming from, it is such a positive environment. It's a little bit like Disney World, so to speak. You walk in and everybody feels good. Everyone says hi to you. The music is on. The new lighting looks really great at the West Loop, for example. It's just a very comforting environment. It feels like home. It feels like a family, a home away from home.
That's great. So you feel like you have two teams that are trying to get you better. Now
Yes.
You have your oncologists, you have your doctors and nurses that help you, and then outside of that, it's funny because I had a student of mine that went through cancer, and I actually even went wig shopping with her.
Yeah.
And I made sure she ate and the whole thing.
Yes.
And her son called me because her son was living a little bit farther away from her, and he thanked me, and I said, you don't have to thank me. I feel like she's part of the family.
Right.
And you don't find that anywhere else other than in a dance studio. Now,
that is true.
What would your message be to other doctors that don't necessarily know dancing does this for patients?
Well, I think, first of all, for me as a person, I think it actually helps me be a better physician and be a better doctor, because I am a happier person. I feel motivated again. Every day I am reminded of how precious life is and how things can really change in an instant, and I encourage people to spend time doing the things that they love, and and to be out there in the world and doing things that make you happy. And so I think for other physicians, we all need a hobby as a way of self-care, because if we're not taking care of ourselves, it's really hard to take care of our patients. And so we have to be really present all day, every day, and you really are not allowed to have a bad day as a physician. I mean, you are, but you're not, because you have to give everything that you have to the patients that are in front of you. And so to recharge at the end of the day with a 40-minute lesson is sometimes just the trick.
Just the trick.
Yeah, and so I think we as physicians all advise our patients physical activity, but sometimes don't know what to suggest. And I think to take a dance class is a really great suggestion that we can all offer our patients, even if you don't do it yourself.
There's times where a patient goes through, when they're feeling tired, like you said, and they don't want to do anything. Mm-hmm. And in some cases, it's almost like they're giving up. Mm-hmm. What does dancing do for that? Because I feel like, with Charlotte, for example, my student Charlotte Johnston, for her, she had something to look forward to.
Yes.
And it got her out of bed to actually be active.
Yes, I think as a physician, I sometimes have to practice a little tough love, where I have to say, if you don't feel like it, you have to go anyway. and you have to keep moving, and you have to keep eating, and you have to push yourself. And I say, would you skip your chemotherapy this week? And the patient say, no, of course I'm going to come for my chemotherapy this week. And then I say, well, then you have to move too. Then you have to do your physical activity and you have to eat, because in a way that's medicine too.
So basically you have to dance.
You have to dance. Keep dancing. Yes, you have to dance. But that is a way of taking care of the whole patient. So the chemotherapy by itself is not enough. The surgery is not enough. You have to take care of the whole body. You have to take care of the mind too.
That's great. And dancing does both.
Absolutely.
Dance is your way to life.
Yeah.
So if I say Fred Astaire Dance Studios, what does that mean to you?
I would say thank you to the studio and to the organization for doing things like this, for taking care of people, for not just teaching dance, but for making people's lives better and more enriched and healthier and happier. And so thank you for what you do.
Very sweet.
Thank you.
When you see somebody that's been taking dance lessons, what does the body respond like? Like, is there a difference on them? Because I remember the doctor saying to my sister, now that you've been taking dance lessons, I see a little bit more consistency in your results.
Mm-hmm. So I think that dance can help psychologically, but can also really have great physical benefits. For example, we know that being of a healthy body weight is really important and can reduce the chance of cancer recurrence and can reduce the risk of death of cancer. And so staying physically active is really important. I think we also know that it's important to have good bone strength, because the stronger you are, the less chance you have of running into things like fractures down the line, for example. And so we do encourage some weight training for our patients, because we want them to have really strong bones and things to begin with. I think too, the stronger and healthier that patients are coming into their treatment, the more treatments that we're able to give. And so we look at something called someone's performance status, and it means how physically active and how physically fit they are prior to treatment. And we actually score patients from a 0 to a 4.
Oh, wow.
And so a 0 is somebody who has no limitations in their daily activities. They're very fit, they're up and about, and then it's really those patients that we're able to develop really aggressive treatment strategies and treatment plans for. We're really aggressive in how we can treat them. And so if somebody is bedbound and spending most of the day on the couch or most of the day sitting in the recliner, we're somewhat limited as physicians in how much treatment we can offer them. So the more active and mobile that someone is, the better for their treatment outcomes.
That's great. Now this month of October is Breast Cancer Month.
Yeah.
What do you think would be a good goal to set to all the patients that are going through treatments? Would you say they should start dancing?
Yes. If they're not dancing, they should start. And if they are dancing, they should continue.
There you go. I like that. Well, you heard it from the doc. Start dancing. And go to the nearest Fred Astaire Dance Studios and start the rest of your life.
Doctor's orders.
That's it. Thank you. This was wonderful. Thank you so much for sharing all this.
My pleasure.